Live from 21st Oncology, I'm so happy to welcome Dr. Ari Dozaret to the show. Good morning. Great to see you.
Good morning. Thanks for having me.
We're going to talk about radiation oncology this morning, and I want to start by maybe talking about radiation, because we were talking during the break, if you don't have maybe a loved one who's been affected by cancer or know somebody, maybe there's some people out there who don't really know what radiation is. So kind of explain what that is.
Yeah, so radiation oncology is basically the use of X-rays, high-powered X-rays, where we as physicians have the ability to place these X-rays to a particular area in the body where we know there's a tumor or a cancer, and very accurately and precisely put them there so that we can kill cancer cells and more effectively cure the cancer and keep it from coming back. That's our goal.
And I know technology plays a huge role in this. With respect to technology, how has that changed the way that the medical advancements that you guys use?
Sure. So in radiation oncology, the technology's actually been revolutionized over the last several decades. We used to just put basically a big box over a huge area of the body that we needed to treat. And so, as you can imagine, a lot of normal tissue that didn't need any radiation got treated. Now we can put this radiation using new machines that we have and new computer algorithms.
Really target that area,
and just as importantly, avoid the areas we don't want treated. And so that's been just a revolutionary sort of change in the field.
I was going to say a huge advancement to be able to kind of focus on and cut down, because you don't really want to hit, good cells with it, right? Which
Absolutely.
is, I assume, what happened before?
Right. I always tell my patients, up there, #1 priority with curing the cancer is not hurting your normal body. And so you always have to make sure as a doctor that you're paying attention to what's nearby to what you're treating. And as a patient, patients should also be very focused on how is this going to affect my quality of life. You don't want the cure to be worse than the
taking you down as you're trying to get better.
Absolutely.
Yeah. Why is that a benefit to the patients? I mean, what do you really want people to know about these medical advancements and the technology that you have and how it benefits the patients?
Well, I think the first thing I want patients to know is that when you get a cancer diagnosis, it's a critical moment in life where you want help and you want to make sure you have people taking care of you that know what they're doing.
The right care.
And so the first thing I always want patients to know is that there is help and that we do have very effective treatments. And so even though it's a very scary moment, our role as physicians is to make sure that they know they're taken care of. From a technology standpoint, the thing I want patients to know is that we're always focused on how can we put these treatments in the areas we care about and kill these cancer cells while avoiding their normal tissue and keeping their quality of life in mind. Because you want patients, as they're getting treated, to as much as they can be able to participate in activities with their loved ones and to have a quality of life that's meaningful to them and not too negatively impacted by their diagnosis. So that's always what we're trying to focus on.
And as you mentioned, we're talking about the right care. You want to select, physicians who know what they're doing, who've dealt with it before. But you're from the area, and you're a third generation. Your father actually started 21st Oncology, right? That's
right. Yeah, my parents are actually from Argentina, and my grandfather was a radiation oncologist in Argentina, and then my father is a radiation oncologist locally and started 21st Century Oncology over 25 years ago at this point. So I kind of grew up around it. Even as a little kid, I could remember patients walking up to my father at gas stations and at supermarkets saying, and telling me, your father helped me so much with my care. And that was a very impactful sort of way to grow up around this, and certainly influenced my decision to go into the field.
I was going to say, I'm sure watching him, care for these patients had some kind of impact on you. And
yeah, absolutely. When you're in medical school, you get exposed to lots of different fields. But for me, there was this idea that you can help somebody in this really critical moment in life, and do it in a way that hopefully they feel taken care of, and that they feel that they are safe with the physician they have. And that was something appealing to me. And so I'm very thankful for that upbringing. Well,
as we close here, if somebody wants to learn more about 21st Oncology or radiation oncology, what's the best way? Is your website a good resource to maybe learn more about you guys in that time when it comes to make that decision? Yeah,
so the 21stcenturyoncology.com, you can find our local offices. We have several in Fort Myers. We have an office as well as in Cape Coral. And that's an easy way to find us. And so if you have any questions, you can go on there, and we're easy to find through phone numbers on the website as well.
Dr. Dozaret, thank you so much. We look forward to having you back.
Thanks for having me.
Go ahead and send it over.